Hello everyone. So today we will discuss about third and lateral ventricles. The objectives are to learn about third ventricle, lateral ventricle, the boundaries and the clinical anatomy. So the ventricular system, it consists of the lateral ventricle, the third ventricle and the fourth ventricle. So here the CSF is formed mainly in the choroid plexus of lateral ventricle, and to the lesser extent it is present in the choroid plexus of third and the fourth ventricles. So the CSF passes from each lateral ventricle to the third ventricle through interventricular foramen. So from the third ventricle, it passes through the cerebral aqueduct to the fourth ventricle. So from the fourth ventricle, the CSF passes to the subarachnoid spaces of cerebrum and the vertebral canal through the median and lateral apertures of the fourth ventricle. So some of them it passes through the central canal of the spinal cord. So diagrammatically we can represent the ventricular system like this, depicting the third ventricle at the center, and on either side you can observe the lateral ventricle communicating with the third ventricle through interventricular foramen, and the third ventricle through the cerebral aqueduct it is leading to fourth ventricle. So easily you can represent the ventricular system like this. So now the third ventricle. So the third ventricle is the median cleft between the two thalami. So here you can observe the thalami. Between the two thalami, the third ventricle is present. Developmentally, it represents the cavity of the diencephalon. So except the area in front of the interventricular foramen, that is derived from the median part of telencephalon. So the cavity is lined by ependyma. So here also you can observe between the two thalami, the third ventricle is present and it is communicating with the lateral ventricles. So the communications anterior-superiorly on each side, it communicates with the lateral ventricle through interventricular foramen, that is also known as the foramen of Monro. This is bounded anteriorly by the column of the fornix and posteriorly by the tubercle of the thalamus. Posterior-inferiorly in the median plane, it communicates with the fourth ventricle through the cerebral aqueduct. The recesses related to the third ventricle, the recesses are nothing but the extensions of the cavity. This includes the suprapineal recess above the pineal gland. The pineal, that is the upper lamina of the recess, is traversed by the habenular commissure and the lower lamina by the posterior commissure. The infundibular recess, then the optic recess. So the vulva is between the diverging columns of the fornix. The boundaries, anterior wall is bounded by the lamina terminalis, anterior column of the fornix. The two columns of the fornix diverge, it passes downwards and backwards and sink into the lateral wall of third ventricle to reach the mammillary body. The posterior wall is formed by the pineal body and the posterior commissure and the cerebral aqueduct. The roof is formed by the body of the fornix and the ependyma lining the under surface of the tela choroidea of the third ventricle. The choroid plexus of the third ventricle projects downwards from the roof. So just if you trace it downwards at the junction of the roof with the anterior and the lateral walls, there are the interventricular foramen. The floor is formed by the hypothalamic structures, that includes optic chiasma, tuber cinereum, infundibulum, that is the pituitary stalk, mammillary bodies, posterior perforated substance. Then the lateral wall is formed by the medial surface of the thalamus, that is in its posterior-superior part, the hypothalamus in its antero-inferior part. The hypothalamic sulcus, here we can observe it is separating the thalamus above and the hypothalamus below. So, this sulcus extends from the interventricular foramen to the cerebral aqueduct. So, the interthalamic adhesions connects the medial surfaces of the two thalami and crosses the ventricular cavity. The clinical aspect, the third ventricle is a narrow space which can be easily obstructed by local brain tumors or by developmental defects. So, this obstruction leads to raised intracranial pressure in the adults and hydrocephalus in infants. The tumors in the lower part of the third ventricle give rise to hypothalamic symptoms like diabetes insipidus, obesity, sexual disturbance, disturbance in sleep, hyperglycemia and the glycosuria. Now, the lateral ventricle. So, these are the two irregular cavities situated one on each cerebral hemisphere. So, this lateral ventricle we have seen the two communicates with the third ventricle through interventricular foramen. So, each part consists of, so here you can see the interventricular foramen through which it is communicating with the third ventricle. So, the lateral ventricle is having the body or the central part, the three horns, that is anterior horn, the posterior horn and the inferior horn. So, the diagrammatically we can depict the body, anterior horn, posterior horn and inferior horn like this. The body or the central part, it extends from the interventricular foramen in front to the splenium of the corpus callosum behind. So, here in the cross section you can observe the body or the central part. The boundaries, the roof is formed by the under surface of the corpus callosum. The floor is formed from lateral to medial side, the caudate nucleus, that is the body of the caudate nucleus, the thalamus, the choroid plexus, the body of the fornix. The medial wall is formed by the septum pellucidum and the body of the fornix. So, here you can observe the septum pellucidum separating the two ventricles. The anterior horn. So, this anterior horn it is present in front of the interventricular foramen. Here you can see which is depicted in the diagram as a green color part. So, it lies in front of the interventricular foramen, extends into the frontal lobe. It is directed forwards, laterally and downwards, and in a cross section it is triangular in shape. So, here you can observe it is triangular in shape. So, the structures surrounding that anterior horn you can observe the corpus callosum, the septum pellucidum in the middle, the head of the caudate nucleus, the column of the fornix. So, now the boundaries, so diagrammatically we can represent and see the boundaries. Anteriorly it is bounded by the posterior surface of the genu and the rostrum of the corpus callosum. The roof is formed by the anterior part of the trunk of the corpus callosum. The floor is formed by the head of the caudate nucleus, and the medially it is bounded by septum pellucidum and the column of the fornix. The posterior on, this is the part of the lateral ventricle lies behind the splenium of the corpus callosum and it extends into the occipital lobe. It is directed backwards and medially. So, here you can observe the posterior on situated in the occipital lobe. The boundaries, the floor and the medial wall formed by the bulb of the posterior on raised by the forceps major. The roof and the lateral wall is formed by the tapetum fibers of the optic radiation. So, here you can observe the posterior on in the cross section. Now, the inferior on, this is the large on of the lateral ventricle, begins at the junction of the central part with its posterior on of the lateral ventricle and it extends into the temporal lobe. So, here you can observe the inferior on present in the temporal bone, that is temporal lobe. So, boundaries, the roof and the lateral wall by the tapetum, then tail of the caudate nucleus, then the stria terminalis and also the amygdaloid body. The floor is formed by the collateral eminence raised by the collateral sulcus. So, here the collateral sulcus is producing the collateral eminence. Then hippocampus medially. So, in the inferior on, the line of ependymal invagination by the choroid plexus lies between the stria terminalis and the fimbrium. So, here you can observe the choroid plexus that is invaginating into the inferior on. The clinical aspect, so the obstruction in the CSF, it leads to the enlargement of the ventricles. So, there will be raised intracranial pressure. So, here you can observe the CT scan picture of the lateral ventricles. The question for the assignment, third ventricle, the boundaries of lateral ventricle, the structures seen in the floor and body of the lateral ventricle and the inferior horn of the lateral ventricle. Thank you.